50 Myocardial Infarction NCLEX Questions, NCLEX Practice Questions. Introduction. Welcome back to NCLEX Made Easy. In today's video, we'll cover 50 myocardial infarction, heart attack, NCLEX practice questions. These questions will help you recognize classic symptoms, identify ECG changes, prioritize nursing interventions, understand medications, and prepare for next-gen NCLEX. Let's begin. Question 1. A client arrives at the emergency department complaining of crushing chest pain that radiates to the left arm. Which action should the nurse perform first? A. Obtain a 12-lead ECG. B. Encourage the client to walk. C. Offer food. D. Place the client in Trendelenburg position. Correct answer, A. Obtain a 12-lead ECG. Rationale: a 12-lead ECG helps identify myocardial infarction quickly. Early diagnosis allows prompt treatment and reduces heart muscle damage. Strategy: prioritize assessments that identify life-threatening conditions. Time is critical in suspected myocardial infarction. Question 2. Which symptom is most commonly associated with myocardial infarction? A. Sharp pain relieved by leaning forward. B. Crushing chest pain. C. Right lower abdominal pain. D. Burning during urination. Correct answer, B. Crushing chest pain. Rationale: crushing chest pain is a classic symptom of myocardial infarction. It may radiate to the jaw, neck, shoulder, or arm. Strategy: learn the hallmark signs of myocardial infarction. Recognizing classic symptoms supports rapid intervention. Question 3. A client with suspected myocardial infarction has an oxygen saturation of 88%. Which prescription should the nurse anticipate? A. Oxygen therapy. B. Restrict fluids. C. High-fiber diet. D. Warm compresses. Correct answer, A. Oxygen therapy. Rationale: oxygen improves tissue oxygenation when hypoxemia is present. It helps reduce myocardial oxygen deficit. Strategy: assess oxygen saturation before interventions. Correct hypoxemia promptly to limit cardiac injury. Question 4. Which laboratory value is most specific for myocardial injury? A. Hemoglobin. B. Troponin. C. Sodium. D. Potassium. Correct answer, B. Troponin. Rationale: troponin is the most sensitive and specific marker of cardiac muscle damage. Elevated levels support the diagnosis of myocardial infarction. Strategy: know the cardiac biomarkers tested during chest pain evaluation. Troponin is the priority marker. Question 5. The nurse administers nitroglycerin to a client with chest pain. Which assessment is the priority afterward? A. Blood pressure. B. Hair color. C. Weight. D. Bowel sounds. Correct answer, A. Blood pressure. Rationale: nitroglycerin can cause hypotension through vasodilation. Blood pressure should be monitored closely after administration. Strategy: monitor for expected medication effects and adverse reactions. Always assess vital signs after giving cardiac medications. Question 6. Which ECG finding indicates an acute ST elevation myocardial infarction? A. ST segment elevation. B. Short PR interval. C. Peaked P waves. D. Flattened T waves only. Correct answer, A. ST segment elevation. Rationale: ST segment elevation indicates acute myocardial injury requiring rapid reperfusion therapy. Immediate treatment improves outcomes. Strategy: become familiar with life-threatening ECG changes. ST elevation requires urgent action. Question 7. A client asks why aspirin is given during a myocardial infarction. What is the best response? A. It lowers cholesterol immediately. B. It prevents platelet aggregation. C. It cures coronary artery disease. D. It increases blood pressure. Correct answer, B. It prevents platelet aggregation. Rationale: aspirin reduces platelet clumping and limits clot growth. This improves blood flow through the coronary arteries. Strategy: know the purpose of emergency cardiac medications. Aspirin helps preserve heart muscle. Question 8. Which finding requires immediate intervention in a client with myocardial infarction? A. Ventricular tachycardia. B. Mild anxiety. C. Temperature of 99 degrees Fahrenheit. D. Slight fatigue. Correct answer: A. Ventricular tachycardia. Rationale: ventricular tachycardia can quickly decrease cardiac output and become life-threatening. Immediate treatment is required. Strategy: prioritize unstable cardiac rhythms over expected symptoms. Treat life-threatening arrhythmias first. Question 9. Which client is at the greatest risk for developing a myocardial infarction? A. A client with uncontrolled hypertension and smoking history. B. A client with seasonal allergies. C. A client with eczema. D. A client with a sprained ankle. Correct answer: A. A client with uncontrolled hypertension and smoking history. Rationale: smoking and uncontrolled hypertension are major risk factors for coronary artery disease and myocardial infarction. They increase damage to blood vessels over time. Strategy: identify modifiable cardiovascular risk factors. Prevention begins with controlling these risks. Question 10. Following a myocardial infarction, which complication is most important for the nurse to monitor? A. Dysrhythmias. B. Dry skin. C. Constipation. D. Blurred vision from reading. Correct answer: A. Dysrhythmias. Rationale: dysrhythmias are common after myocardial infarction because damaged heart tissue disrupts electrical conduction. They can become fatal if untreated. Strategy: continuously monitor cardiac rhythm after myocardial infarction. Early recognition improves patient survival. Question 11. A client with a suspected myocardial infarction is prescribed chewable aspirin. Why should the nurse instruct the client to chew the tablet? A. It works faster when chewed. B. It prevents stomach ulcers. C. It lowers blood pressure immediately. D. It improves kidney function. Correct answer: A. It works faster when chewed. Rationale: chewing aspirin allows it to be absorbed more quickly into the bloodstream. Faster absorption helps reduce platelet aggregation during an acute MI. Strategy: know the reason behind emergency medication administration. Faster drug action is critical in time-sensitive conditions. Question 12. Which client is at the highest risk for developing a myocardial infarction? A. A 60-year-old with diabetes, hypertension, and a smoking history. B. A 25-year-old who exercises daily. C. A 30-year-old with seasonal allergies. D. A 22-year-old with a fractured wrist. Correct answer: A. A 60-year-old with diabetes, hypertension, and a smoking history. Rationale: diabetes, hypertension, advancing age, and smoking are major risk factors for coronary artery disease and myocardial infarction. Multiple risk factors greatly increase the likelihood of an MI. Strategy: identify clients with multiple cardiovascular risk factors. They require close monitoring and preventive education. Question 13. A client with an acute MI reports chest pain rated 8 out of 10. After administering nitroglycerin, which finding indicates the medication is effective? A. Chest pain decreases to 0.2. B. Blood glucose rises. C. Respiratory rate increases. D. Temperature decreases. Correct answer: A. Chest pain decreases to 0.2. Rationale: reduced chest pain indicates improved blood flow to the heart muscle. The nurse should continue to monitor pain and blood pressure. Strategy: evaluate the effectiveness of medications by reassessing the primary symptom. Always compare findings before and after treatment. Question 14. Which complication is most common during the first 24 hours after a myocardial infarction? A. Cardiac dysrhythmias. B. Appendicitis. C. Pneumonia. D. Peptic ulcer disease. Correct answer, A. Cardiac dysrhythmias. Rationale: damaged heart tissue can disrupt normal electrical conduction, leading to dysrhythmias. Continuous cardiac monitoring is essential during the acute phase. Strategy: monitor closely for complications that are most likely to occur early after an MI. Dysrhythmias can become life-threatening. Question 15. The nurse is caring for a client with an MI who suddenly becomes short of breath and develops crackles in both lungs. What should the nurse suspect? A. Pulmonary edema. B. Constipation. C. Liver failure. D. Dehydration. Correct answer, A. Pulmonary edema. Rationale: pulmonary edema occurs when the left ventricle cannot effectively pump blood, causing fluid to back up into the lungs. It is a serious complication of myocardial infarction. Strategy: connect respiratory symptoms with cardiac complications. Report signs of fluid overload immediately. Question 16. Which cardiac biomarker rises earliest after myocardial injury? A. Myoglobin. B. Calcium. C. Albumin. D. Bilirubin. Correct answer, A. Myoglobin. Rationale: myoglobin rises within a few hours of myocardial injury but is less specific than troponin. Troponin remains the preferred marker for confirming an MI. Strategy: know the timing and significance of cardiac biomarkers. Understand which tests are most specific. Question 17. A client with an acute MI asks why bed rest is recommended initially. What is the nurse's best response? A. It reduces the heart's workload and oxygen demand. B. It prevents dehydration. C. It improves digestion. D. It strengthens the heart muscle immediately. Correct answer, A. It reduces the heart's workload and oxygen demand. Rationale: limiting activity decreases myocardial oxygen consumption while the heart heals. This helps reduce further cardiac damage. Strategy: explain interventions in simple terms. Help clients understand the purpose behind activity restrictions. Question 18. The nurse is preparing to administer thrombolytic therapy to a client with an acute STEMI. Which assessment is the priority before administration? A. Check for active bleeding or a history of hemorrhagic stroke. B. Measure the client's height. C. Assess bowel sounds. D. Check visual acuity. Correct answer, A. Check for active bleeding or a history of hemorrhagic stroke. Rationale: thrombolytics significantly increase the risk of bleeding and are contraindicated in clients with certain bleeding conditions. Screening for contraindications is essential. Strategy: always assess for contraindications before administering high-risk medications. Patient safety comes first. Question 19. Which statement by a client recovering from an MI indicates a need for further teaching? A. I'll stop taking my medications when I feel better. B. I'll attend my follow-up appointments. C. I'll eat foods that are low in saturated fat. D. I'll quit smoking. Correct answer, A. I'll stop taking my medications when I feel better. Rationale: cardiac medications should be continued as prescribed even when symptoms improve. Stopping them without medical advice increases the risk of another MI. Strategy: assess clients' understanding of long-term medication adherence. Correct unsafe statements immediately. Question 20. The nurse is caring for 4 clients. Which client should be assessed first? A. A client with an MI who develops severe chest pain and a heart rate of 38 beats/min. B. A client requesting pain medication for arthritis. C. A client asking for discharge instructions. D. A client waiting for a scheduled blood draw. Correct answer, A. A client with an MI who develops severe chest pain and a heart rate of 38 beats/min. Rationale: severe chest pain with symptomatic bradycardia may indicate worsening myocardial ischemia and unstable cardiac status. Immediate assessment and intervention are required. Strategy: Prioritize clients with acute changes affecting circulation. Unstable cardiac conditions always take precedence over routine care. Question 21. A client recovering from a myocardial infarction suddenly becomes pale, cool, and confused with a blood pressure of 78/48 mm of mercury. Which complication does the nurse suspect? A. Cardiogenic shock. B. Stable angina. C. Hypertension. D. Deep vein thrombosis. Correct answer, A. Cardiogenic shock. Rationale: cardiogenic shock occurs when the damaged heart cannot pump enough blood to meet the body's needs. It is a life-threatening complication of myocardial infarction. Strategy: watch for signs of poor perfusion after an MI. Low blood pressure with altered mental status requires immediate intervention. Question 22. The nurse is teaching a client about reducing the risk of another myocardial infarction. Which statement by the client indicates understanding? A. I'll continue smoking only on weekends. B. I'll stop taking my medications when I feel better. C. I'll take my medications as prescribed and quit smoking. D. Exercise is not necessary after a heart attack. Correct answer, C. I'll take my medications as prescribed and quit smoking. Rationale: medication adherence and smoking cessation significantly reduce the risk of another heart attack. Lifestyle changes are essential for long-term heart health. Strategy: reinforce teaching about modifiable risk factors. Evaluate client understanding through their statements. Question 23. Which assessment finding suggests successful reperfusion after treatment for an ST elevation myocardial infarction? A. Chest pain decreases. B. Blood pressure continues to fall. C. Urine output stops. D. Increasing shortness of breath. Correct answer, A. Chest pain decreases. Rationale: relief of chest pain often indicates improved blood flow to the heart muscle. Other findings should also be monitored to confirm recovery. Strategy: compare the client's symptoms before and after treatment. Improvement suggests therapy is effective. Question 24. Which medication is commonly prescribed after a myocardial infarction to reduce the heart's workload and oxygen demand? A. Metoprolol. B. Amoxicillin. C. Acetaminophen. D. Furosemide eye drops. Correct answer, A. Metoprolol. Rationale: beta blockers decrease heart rate and blood pressure, reducing myocardial oxygen demand. They also lower the risk of recurrent cardiac events. Strategy: know the purpose of common post-MI medications. Understand how each drug protects the heart. Question 25. A client with myocardial infarction reports chest pain rated 9 out of 10 despite receiving nitroglycerin. Which medication should the nurse anticipate next? A. Morphine. B. Insulin. C. Diphenhydramine. D. Vitamin K. Correct answer, A. Morphine. Rationale: morphine relieves persistent chest pain and decreases anxiety, reducing cardiac workload. It is used when nitroglycerin is ineffective. Strategy: follow the treatment sequence for persistent chest pain. Reassess pain after every intervention. Question 26. Which finding places a client at increased risk for myocardial infarction? A. High LDL cholesterol. B. Normal blood pressure. C. Regular exercise. D. Healthy body weight. Correct answer, A. High LDL cholesterol. Rationale: high LDL cholesterol contributes to plaque buildup in the coronary arteries. This increases the risk of coronary artery blockage. Strategy: remember the major cardiovascular risk factors. Focus on findings that promote atherosclerosis. Question 27. The nurse should instruct a client taking nitroglycerin tablets to A. Sit or lie down before taking the medication. B. Swallow the tablet with water immediately. C. Take it only after eating a large meal. D. Store it in the bathroom medicine cabinet. Correct answer, A. Sit or lie down before taking the medication. Rationale: nitroglycerin may cause dizziness and hypotension. Sitting or lying down reduces the risk of falls. Strategy: include safety precautions when teaching about medications. Prevent injury from expected side effects. Question 28. A client with myocardial infarction suddenly develops crackles in both lungs. What does the nurse suspect? A. Left-sided heart failure. B. Kidney infection. C. Liver disease. D. Dehydration. Correct answer: A. Left-sided heart failure. Rationale: crackles indicate fluid accumulation in the lungs caused by left ventricular dysfunction. This is a common complication after myocardial infarction. Strategy: connect respiratory findings with cardiac function. Pulmonary congestion suggests worsening heart performance. Question 29. Which statement about myocardial infarction requires further teaching? A. I'll eat a heart-healthy diet. B. I'll attend my follow-up appointments. C. I'll stop taking aspirin once I feel fine. D. I'll monitor my blood pressure regularly. Correct answer: C. I'll stop taking aspirin once I feel fine. Rationale: aspirin should not be discontinued without the healthcare provider's approval. Stopping it may increase the risk of another heart attack. Strategy: listen for statements that show unsafe medication practices. Lifelong therapy is often necessary after an MI. Question 30. The nurse is caring for 4 clients. Which client should be assessed first? A. A client with an MI reporting new crushing chest pain. B. A client requesting assistance with bathing. C. A client asking for a meal tray. D. A client ready for discharge teaching. Correct answer: A. A client with an MI reporting new crushing chest pain. Rationale: new crushing chest pain may indicate ongoing or recurrent myocardial ischemia and requires immediate assessment. Delayed treatment can result in further heart muscle damage. Strategy: prioritize clients with actual or suspected life-threatening conditions. Airway, breathing, circulation, and acute chest pain always come first. Question 31. A client with a myocardial infarction asks why continuous cardiac monitoring is necessary. What is the best response? A. It detects dangerous heart rhythm changes early. B. It measures your oxygen level. C. It checks your blood sugar. D. It prevents another heart attack. Correct answer: A. It detects dangerous heart rhythm changes early. Rationale: dysrhythmias are common after an MI and can become life-threatening. Continuous ECG monitoring allows rapid identification and treatment. Strategy: know why clients are placed on cardiac monitors. Early detection of complications improves outcomes. Question 32. Which client is most likely experiencing an inferior wall myocardial infarction? A. A client with nausea, vomiting, and chest discomfort. B. A client with a sore throat. C. A client with right ankle pain. D. A client with blurred vision only. Correct answer: A. A client with nausea, vomiting, and chest discomfort. Rationale: inferior wall MI is commonly present with gastrointestinal symptoms in addition to chest pain. These symptoms should never be ignored. Strategy: remember that MI symptoms can vary. Older adults and women may present atypically. Question 33. Which medication helps prevent clot formation after a myocardial infarction? A. Clopidogrel. B. Acetaminophen. C. Omeprazole. D. Loratadine. Correct answer: A. Clopidogrel. Rationale: clopidogrel inhibits platelet aggregation and reduces the risk of future coronary artery blockage. It is commonly prescribed after an MI. Strategy: differentiate antiplatelet medications from drugs used for symptom relief. Focus on their primary actions. Question 34. The nurse should immediately report which finding in a client with myocardial infarction? A. New onset shortness of breath. B. Mild fatigue. C. Heart rate of 78 beats/min. D. Temperature of 98.8 degrees Fahrenheit 37.1 degrees Celsius. Correct answer, A. New onset shortness of breath. Rationale: sudden shortness of breath may indicate heart failure or worsening cardiac function. Prompt evaluation is required. Strategy: report unexpected respiratory changes immediately. They may signal serious complications. Question 35. Which dietary choice is best for a client recovering from a myocardial infarction? A. Grilled fish with vegetables. B. Fried chicken and fries. C. Bacon and sausage. D. Buttered pastries. Correct answer, A. Grilled fish with vegetables. Rationale: heart-healthy foods are low in saturated fat and support cardiovascular recovery. Healthy eating helps reduce future cardiac risk. Strategy: reinforce lifestyle modifications after an MI. Encourage foods that promote heart health. Question 36. A client reports chest pain after climbing stairs 1 week after discharge for an MI. What should the nurse advise first? A. Stop the activity and take nitroglycerin as prescribed. B. Continue exercising. C. Ignore the discomfort. D. Drink coffee. Correct answer, A. Stop the activity and take nitroglycerin as prescribed. Rationale: activity should stop immediately when chest pain occurs. Nitroglycerin may relieve myocardial ischemia. Strategy: teach clients how to respond to recurring chest pain. Encourage early action rather than waiting. Question 37. Which assessment finding suggests decreased cardiac output after an MI? A. Cool, clammy skin. B. Warm, dry skin. C. Increased appetite. D. Clear lung sounds with stable vital signs. Correct answer, A. Cool, clammy skin. Rationale: poor cardiac output reduces tissue perfusion, causing cool and clammy skin. This finding requires prompt assessment. Strategy: evaluate signs of poor circulation. Perfusion is a priority after an MI. Question 38. Which diagnostic test best evaluates the electrical activity of the heart during an acute MI? A. Electrocardiogram (ECG). B. Chest X-ray. C. Abdominal ultrasound. D. Colonoscopy. Correct answer, A. Electrocardiogram (ECG). Rationale: an ECG identifies ischemia, injury, and infarction by detecting electrical changes in the heart. It is performed immediately when an MI is suspected. Strategy: associate diagnostic tests with their purpose. The ECG is the first-line test for chest pain. Question 39. The nurse explains that cardiac rehabilitation primarily helps clients: A. Improve recovery through supervised exercise and education. B. Avoid all physical activity. C. Eliminate the need for medications. D. Cure coronary artery disease. Correct answer, A. Improve recovery through supervised exercise and education. Rationale: cardiac rehabilitation improves physical fitness, education, and long-term cardiovascular health. It lowers the risk of future cardiac events. Strategy: encourage participation in rehabilitation programs. They are an important part of recovery after an MI. Question 40. A client with an MI suddenly loses consciousness and has no pulse. What is the nurse's first action? A. Begin CPR immediately. B. Check blood glucose. C. Obtain a blood pressure. D. Document the findings. Correct answer, A. Begin CPR immediately. Rationale: a pulseless client requires immediate cardiopulmonary resuscitation to restore circulation. Delaying CPR decreases survival. Strategy: follow basic life support priorities. Immediate action saves lives. Question 41. Which risk factor for myocardial infarction cannot be modified? A. Age. B. Smoking. C. Obesity. D. High cholesterol. Correct answer, A. Age. Rationale: age is a non-modifiable risk factor for coronary artery disease. Lifestyle factors can be changed to lower overall risk. Strategy: distinguish modifiable from non-modifiable risk factors. Focus teaching on factors clients can control. Question 42. A client asks why troponin levels are repeated several hours after admission. The nurse explains that A. Troponin levels rise over time after heart muscle injury. B. Troponin measures kidney function. C. Troponin checks liver health. D. Troponin measures lung capacity. Correct answer: A. Troponin levels rise over time after heart muscle injury. Rationale: serial troponin testing helps confirm myocardial damage and monitor its progression. Rising levels support the diagnosis of MI. Strategy: understand the timing of laboratory tests. Repeat measurements improve diagnostic accuracy. Question 43. Which finding indicates that nitroglycerin is effective? A. Chest pain decreases. B. Heart rate increases significantly. C. Temperature rises. D. Blood glucose falls. Correct answer: A. Chest pain decreases. Rationale: relief of chest pain indicates improved coronary blood flow. The client should also be monitored for hypotension. Strategy: evaluate medication effectiveness by reassessing symptoms. Compare findings before and after treatment. Question 44. A client recovering from an MI asks when to call emergency services after taking nitroglycerin. Which response is correct? A. If chest pain continues after the first dose, seek emergency help as instructed while continuing prescribed dosing. B. Wait until the next day. C. Finish the entire bottle first. D. Ignore the pain if it improves slightly. Correct answer: A. If chest pain continues after the first dose, seek emergency help as instructed while continuing prescribed dosing. Rationale: persistent chest pain may indicate an ongoing myocardial infarction requiring immediate medical care. Delaying treatment increases heart muscle damage. Strategy: teach clients the emergency plan before discharge. Reinforce the correct use of nitroglycerin. Question 45. Which laboratory value should the nurse closely monitor in a client receiving heparin? A. APTT. B. Hemoglobin A1C. C. Calcium. D. Bilirubin. Correct answer: A. APTT. Rationale: activated partial thromboplastin time (APTT) evaluates the therapeutic effect of heparin. It helps reduce the risk of bleeding. Strategy: match anticoagulants with the laboratory tests used to monitor them. Question 46. Which client statement indicates the need for additional teaching? A. I'll stop exercising because my heart is weak. B. I'll attend cardiac rehabilitation. C. I'll eat less saturated fat. D. I'll take my medications every day. Correct answer: A. I'll stop exercising because my heart is weak. Rationale: regular exercise under medical guidance improves cardiovascular health after recovery. Avoiding all activity is not recommended. Strategy: correct misconceptions about recovery. Safe physical activity is part of long-term treatment. Question 47. A client develops frequent premature ventricular contractions after an MI. Why is this concerning? A. They may progress to life-threatening ventricular dysrhythmias. B. They always indicate recovery. C. They increase appetite. D. They improve cardiac output. Correct answer: A. They may progress to life-threatening ventricular dysrhythmias. Rationale: frequent PVCs can precede ventricular tachycardia or ventricular fibrillation. Immediate assessment is necessary. Strategy: treat worsening cardiac rhythms as a priority. Continuous monitoring is essential. Question 48. The nurse identifies which outcome as the priority for a client with an acute myocardial infarction? A. Adequate tissue perfusion. B. Weight loss. C. Improved vision. D. Better sleep pattern. Correct answer, A. Adequate tissue perfusion. Rationale: restoring and maintaining adequate perfusion limits heart muscle damage and supports organ function. It is the primary goal during acute care. Strategy: focus on circulation and oxygen delivery. Prioritize interventions that preserve cardiac function. Question 49. Which discharge instruction is most important for a client after an MI? A. Report any recurring chest pain immediately. B. Avoid drinking water. C. Stop all medications after 1 week. D. Skip follow-up appointments if feeling well. Correct answer, A. Report any recurring chest pain immediately. Rationale: recurring chest pain may indicate recurrent ischemia or another myocardial infarction. Prompt evaluation can be life-saving. Strategy: teach clients to recognize warning signs that require urgent medical attention. Question 50. A nurse is caring for 4 clients. Which client should be seen first? A. A client with a history of MI who reports sudden chest pressure and diaphoresis. B. A client requesting assistance to the restroom. C. A client asking about discharge paperwork. D. A client waiting for a routine dressing change. Correct answer, A. A client with a history of MI who reports sudden chest pressure and diaphoresis. Rationale: chest pressure with diaphoresis suggests acute myocardial ischemia and requires immediate assessment. Rapid intervention can prevent further heart muscle damage. Strategy: use ABCs and prioritize clients with signs of compromised circulation. Acute chest pain always takes precedence over routine care.